Every year, more than 30 million people are exposed to new infectious threats, many of which never reach the news. But what if I told you that 5 prevention methods, proven across centuries, could dramatically reduce the next pandemic before it even begins? And here's the question that matters most. If we understand what works, why do we keep repeating the same mistakes? For centuries, humanity has danced in circles with disease. Pandemics rise, people panic, governments react too late, historians argue afterward, and the cycle quietly resets, always waiting for the next spark. But hidden inside old archives, ship logs, monastic records, and modern epidemiology labs are strategies that have worked over and over again. Some were created out of desperation, some were rediscovered by accident, and some have been sitting in plain sight for hundreds of years, ignored until it's too late. The numbers paint a brutal picture. The Black Death killed up to 200 million people. The 1918 flu infected 1/3 of humanity. SARS spread across 26 countries in 2003 despite lasting only a few months. COVID-19 infected over 600 million people and cost the global economy trillions. But within these dark chapters, there were also unexpected victories. Villages that survived while neighbors collapsed, cities that cut mortality in half through simple methods, and doctors who noticed patterns decades before scientists did. And among the people trying to piece those clues together is one historian, Dr. Alaric Rowan, who spent 25 years studying pandemics not as tragedies, but as systems. Systems that break down in predictable ways. Systems that can be protected. He believed that 5 prevention methods, some ancient, some modern, could save millions if applied early and intelligently. This is his story, and the story of the people across history who accidentally invented pandemic prevention before the world even knew what a germ was. It begins not in a laboratory, but on a quiet hillside monastery in 1348, as bells toll for the dead. Rowan often describes disease like a river. It never stops, he says. It only finds new channels. His research began with a single question. Why did some medieval towns survive while others vanished from a map? The deeper he looked, the stranger the answers became. In Tuscany, monks who lived behind stone walls unknowingly implemented early quarantine. In Norway, fishing villages created controlled entry points centuries before border health checks existed. In Ottoman Istanbul, clerics maintained public cleanliness rules that reduced plague transmission without knowing the science behind it. In India, local communities practiced forms of contact tracing using chalk marks on doors. None of them understood bacteria or viruses, but patterns emerged through trial, error, and pure necessity. Rowan cataloged more than 480 case studies from ancient and modern pandemics. Across them, the same 5 principles reappeared, sometimes crude, sometimes advanced, but always effective. Control movement, control air, control water and waste, control information, control time. These 5 controls were the heartbeat of every society that survived pandemics better than their neighbors. But to understand how they worked and why they still matter, we need to look back at the world's worst outbreaks. The Black Death moved like a firestorm, fast, unpredictable, and devastating. Entire families died in a single week. Trade routes collapsed. Cities emptied. Yet tiny clusters of survivors existed. In Milan, authorities bricked infected families inside their homes. Brutal but effective. Mortality rates were 1/3 lower. In Ragusa, modern Dubrovnik, ships were forced to wait outside the city for 30 days, later increased to 40. That word quarantine comes from quaranta, meaning 40. Without knowing the science, they slowed transmission dramatically. Fast forward to 1918. The world was exhausted from war. Troop ships carried influenza across continents in days. Fatalities were catastrophic. Young, healthy adults died at terrifying rates, their immune systems turning against them. Yet one U.S. city, St. Louis, had half the death rate of Philadelphia. Why? Because St. Louis shut down gatherings early. Philadelphia held a parade. The difference between caution and celebration cost thousands of lives. COVID-19 revealed something different. The world was prepared technologically, but unprepared logistically. Rapid tests existed, but were distributed slowly. Governments debated measures instead of coordinating them. Some countries with early border controls and strong health systems had drastically lower mortality. Across history, across continents, across centuries, these same 5 methods kept appearing. Rowan realized they were not random coincidences. They were human instincts refined into survival strategies, and he believed they could form the backbone of future pandemic defenses. The first method was about movement, controlling who enters, who leaves, and how people interact. The earliest versions were crude: guards blocking roads, soldiers stopping wagons, village elders forbidding festivals. But even those primitive controls saved thousands. Rowan discovered a fascinating example from 17th century England. When plague hit, the entire village voluntarily isolated. No one entered. No one left. Merchants left food on a marked boundary stone, and villagers paid with coins soaked in vinegar. Lost many people, but the plague never reached neighboring towns. Their sacrifice worked. Modern equivalents are far more sophisticated. Targeted travel restrictions, digital border checks, wastewater monitoring at airports, and the early identification of super-spreader environments. But the principle is the same: slow the river movement and you slow the spread. Air was always the invisible enemy. Medieval doctors believed in bad air, which was wrong but ironically helpful. Cities that improved ventilation, open windows, space beds, outdoor gatherings had lower mortality. During the 1918 flu, open-air hospitals in Boston recorded significantly lower death rates than closed wards. During COVID-19, ventilation and filtration became one of the most powerful tools, yet public understanding lagged far behind hand-washing. Water and waste control seem obvious today, but historically they were revolutionary. In 1854, Dr. John Snow traced a cholera outbreak in London to a single water pump. This discovery birthed modern epidemiology. Yet even before him, many societies instinctively separated drinking water from waste, sometimes due to religious rules, sometimes local custom. These communities consistently saw lower disease levels. Information control is the strangest method, but Rowan found it everywhere. Societies that shared accurate information early, without panic or denial, saved more lives. Leaders who had outbreaks, whether popes, kings, or modern governments, always worsen the situation. Rumors kill faster than germs. And time, perhaps the most powerful method of all. Pandemics reward fast movers. The earlier response begins, the fewer people die. But humans, historically, are slow to react. Fear, pride, politics, all get in the way. Dr. Rowan called this the fatal delay. Every great pandemic had one: the weeks of hesitation, disbelief, or wishful thinking before action began. Each of the 5 methods had saved lives across history. But Rowan wondered, could they work together? Could they form a unified system that prevents pandemics entirely? He believed yes, and he argued it fiercely. To build his case, Rowan traveled. He visited abandoned medieval villages in France, read Ottoman plague records in Istanbul, studied Japanese isolation protocols from the 1700s, and interviewed modern epidemiologists. A lifetime of research took shape. He even recreated a medieval isolation hut using authentic materials to understand airflow patterns. He modeled disease spread in computer simulations. Everything pointed toward the same truth: pandemics are not unstoppable. Humanity simply fails to use the tools we already have. Rowan published papers, gave lectures, debated skeptics. Some experts resisted. Modern pandemics require modern solutions, they argued. But Rowan pushed back. Modern solutions only work if we use them in time. His most dramatic argument came from an obscure archive in Venice. In the 1500s, Venetian health officers created what historians now call the quarantine machine, a network of checkpoints, isolation houses, inspectors, sanitation teams, and information collectors. For 2 centuries, Venice maintained one of the most sophisticated public health systems in the world. And it worked. While plague ravaged Europe repeatedly, Venice suffered less than many neighboring regions. Rowan believed that if Venice could build such a system in the 1500s, with no microscopes, no vaccines, no scientific understanding of germs, then the modern world had no excuse. He identified 5 modern strategies based on the ancient methods, all scientifically proven, all repeatedly ignored until too late. Early movement buffers, ventilation first public health, real-time wastewater disease tracking, transparent outbreak reporting, rapid emergency time protocols. Each method, applied early, could cut transmission dramatically, but they require political courage, public cooperation, and global coordination. Conditions historically rare. Rowan often said, "Pandemics don't reveal what we don't know. They reveal what we refuse to do." But he wasn't just a critic. He offered solutions, practical, affordable, realistic. The first solution was creating health firewalls at borders, not blanket restrictions, but intelligent ones based on real-time genomic data. Several airports now test wastewater for viruses weekly. This single tool detected COVID variants weeks before official reports. The second solution focused on air. Instead of expensive renovations, Rowan pushed for simple ventilation standards, monitored CO2 levels, low-cost air purifiers, open-air classrooms when possible. Small actions, big impact. The third solution involved water and waste. Cities could track disease by sampling sewage. This method detected flu surges in the U.S. months in advance. Imagine using that time to prepare hospitals, warn communities, and activate prevention. The fourth solution centered on information warfare. Misinformation spreads faster than viruses. Rowan proposed rapid response truth teams, scientists trained to communicate clearly, simply, and without politics. And the fifth solution was all about time. The biggest killer in pandemics is hesitation. He proposed global 48-hour protocols. Emergency measures triggered automatically when an outbreak reaches certain thresholds. No debate, no confusion, just action. Rowan believed these 5 modern methods could prevent the next pandemic, or at least blunt it so severely that it never becomes global. Years passed. Some listened, some dismissed him, but his research influenced policies quietly across Europe and Asia. Then something unexpected happened. A cluster of strange cases appeared in rural Southeast Asia. Fever, rash, neurological symptoms. Local doctors noticed the pattern. Wastewater picked it up next. Within days, regional health teams acted. Movement was monitored. Samples collected. Data shared globally. Transparency replaced secrecy. Airflow guidelines were implemented in clinics. Information campaigns launched immediately. Within 3 weeks, the outbreak burned out. It never became a pandemic. It barely made the news. And Dr. Alaric Rowan received an email from a young epidemiologist on the ground. "Your methods saved us. They worked exactly as you said." Rowan read that line over and over, not out of pride, but relief. Humanity had, for once, moved faster than the virus. So what does this mean for our future? Pandemics will come again. New viruses emerge every year. But we are not helpless. We have the knowledge of centuries, the data of modern science, and the technology to detect threats before they spread. The real question is whether we will be ready, whether we will act early, act intelligently, and act together, because prevention is not magic. It is preparation. It is discipline. It is learning from the past instead of repeating it. And as Dr. Rowan often said, the next pandemic isn't inevitable, but our inaction is. If you want more deep historical investigations like this, subscribe, because I bring you stories the world forgets, the lessons history left behind, and the knowledge that can shape tomorrow.